Facial nerve is the seventh cranial nerve. It emerges from the pons of the brainstem and controls the muscles of facial expression, function of the conveyance of taste sensation. It innervates the salivary gland, such as submandibular and sublingual glands, and it also innervates the lacrimal gland. Here we can see the intracranial segment of the facial nerve. First one is the cisternal segment in the cerebellopontine angle. Then facial nerve enters the internal acoustic meatus. Then it goes to the bottom of internal acoustic meatus and enters so-called facial canal, which is divided into three parts. Here we can see the labyrinthine segment just above the cochlea and the 19-degree turn in the region of geniculate ganglion. Here, from the geniculate ganglion, branches off first of the branches of the facial nerve, so-called greater petrosal nerve. It is involved in lacrimation. Then the main trunk of the facial nerve goes posteriorly and downward, below the lateral semicircular canal. It is the tympanic segment of the facial nerve. Then it descends in the mastoid part of the facial nerve and leaves the intracranial course through the stylomastoid foramen. There are no branches of the facial nerve in its tympanic part. In the mastoid part of the facial nerve, there are two main branches. First one goes through the pyramidal eminence to the stapedius muscle and innervates it. Then there is chorda tympani. It branches off in the inferior part of the mastoid segment of the facial nerve, and it ascends to the tympanic cavity and goes between the malleus and incus. And then it leaves the tympanic cavity and goes through the petrotympanic fissure and connects to the lingual nerve, which is a branch of the trigeminal nerve. Facial nerve leaves its canal through the stylomastoid foramen. Then it gives off a few branches to the muscles of the external ear and the digastric muscle. As you see, all of the muscles of the head are innervated by the facial nerve. The only except are four muscles that are innervated by the trigeminal nerve. It is masseter muscle, temporalis muscle, and two pterygoid muscles, lateral and medial. In order to understand the peripheral facial palsy, you have to know the details of the anatomy of the course of the facial nerve. As you see, there are 5 main points in which the facial nerve can be damaged. We suspect the damage of the facial nerve in its extracranial part when there is only a peripheral paralysis of muscles of facial expression. When we add to the peripheral paralysis of muscles of facial expression the impairment of taste and lacrimation disorders, we can suspect that the damage is done in the mastoid segment of the facial nerve, including chorda tympani nerve. When adding the hyperacusis to to the peripheral paralysis of the muscles of facial expression, taste and lacrimation disorders, we may know that the damage is done above the chorda tympani, including the nerve to the stapedius muscle. When the damage is done in the area of geniculate ganglion, in the area of labyrinthine segment or tympanic segment, we expect that there will be a peripheral paralysis of muscles of facial expression, taste, lacrimation and salivatory disorders, and hyperacusis. When the damage is done inside the internal acoustic meatus, we can expect, among others, the deafness and the vestibular disorders, for example, tinnitus and vertigo. As the facial nerve leaves the facial canal through the stylomastoid foramen, in between the mastoid process and styloid process, it branches off posterior auricular nerve and the branch to the posterior belly of the digastric muscle. Then the main trunk enters the parotid gland to divide into two main branches and then into the terminal branches of the so-called parotid plexus. The terminal motor branches of cranial nerve the seventh are divided into 5 groups of branches. And then we can find the temporal branches, zygomatic branches, buccal branches, marginal mandibular branch, and the cervical branch. There are usually 2 to 3 temporal branches of the facial nerve. They supply superior auricular and anterior auricular muscles, front belly of occipitofrontalis muscle, superior part of orbicularis oculi muscle, corrugator supercilii muscle, and depressor supercilii muscle. Second group of branches is zygomatic group. There are usually 3 to 4 branches, and they supply lateral and inferior part of orbicularis oculi muscle, zygomatic major muscle, and zygomatic minor muscle. The buccal group is represented usually by 6 to 8 branches. They supply buccinator muscle, risorius nasalis muscles, levator labii superioris, depressor septi nasi, procerus muscle, levator angulioris, and orbicularis oris muscle, especially superior part of it. Marginal mandibular branch is a separate branch that goes to the depressor angulioris muscle, mentalis muscle, and depressor labii inferioris muscle. It may be in danger during the surgical removal of submandibular gland. Cervical branch of the cranial nerve the seventh goes down on the neck to the platysma muscle, and it may connect to the superior branch of the transverse cervical nerve. Parotid gland is a major paired salivary gland of head and neck, along with the submandibular and sublingual glands. Parotid gland can be divided into 2 parts, the deep part and the superficial part. Between these 2 parts, there is main trunk of facial nerve that divides into superior and inferior parts and then in its terminal branches. In this specimen, we can see the remnants of the superficial part of the parotid gland. They are removed to visualize the branches of the facial nerve. Deep to the facial nerve is the deep part of the parotid gland. The parotid gland covers the region posterior to the ramus of the mandible and to the masseter muscle. Inside the parotid gland we can see the main trunk of the extracranial part of the facial nerve. It divides into 5 groups of nerves. Here we can see the temporal branches going to the superior part of the face. These branches are called zygomatic branches. Then there is a group of buccal branches, the marginal mandibular branch at the edge of the mandible, and then the cervical branch going at the lateral aspect of the sternocleidomastoid muscle. Parotid region is posterolateral part of the facial region. Borders of it are as follows: zygomatic arch superiorly, external ear and sternocleidomastoid muscle posteriorly, ramus of the mandible medially, masseter muscle anteriorly, and inferior border of the mandible inferiorly. In this region we can find the parotid gland. Here are the remnants of it, and branches of the facial nerve, and the terminal branches of the external carotid artery. Facial artery is a third anterior branch of the external carotid artery. It lies behind the posterior belly of the digastric muscle, stylohyoid muscle, and submandibular gland. It crosses the mandible along the anterior border of the masseter and supplies the muscle of facial expression. Branches of facial artery can be divided into 2 parts: cervical part and facial part. Cervical part includes ascending palatine artery, tonsillar branch, submental artery, and glandular branches to submandibular gland. Facial group of branches of facial artery includes inferior labial artery, superior labial artery, so-called lateral nasal branch or branches, and the angular artery. Angular artery is a terminal branch of the facial artery in the medial angle of the eye. It anastomoses with the ophthalmic artery via the dorsal nasal artery. Ascending palatine artery ascends on the lateral wall of the pharynx, beneath the styloglossus muscle, to the palatoglossal and palatopharyngeal arches, soft palate, and palatine tonsil. It can replace or be replaced by the ascending pharyngeal artery, which is a direct branch of external carotid artery. Glandular branches are small arteries that go to the submandibular salivary gland. Inferior labial artery is a branch supplying the region of lower lip and orbicularis oris muscle. Superior labial artery supplies the region of the upper lip and upper part of orbicularis oris muscle. Facial artery is a branch of external carotid artery and supplies superficial face. It branches off as a third vessel at anterior surface of the external carotid artery. It gives 2 main group of branches: cervical group of branches and facial group of branches. The facial part of the facial artery gives off 4 branches. It is inferior labial artery going inferiorly to the lower lip, superior labial artery going superiorly to the upper lip. Then there are a group of branches at the lateral side of the nose. They are called lateral nasal branches. And then there is a terminal branch of the facial artery in its facial region. It is the angular artery. It goes to the medial aspect of the eye and it connects to the ophthalmic artery. The facial artery is easily spotted
between the muscles of the mouth and the masseter muscle, at the border between the head and the neck, at the inferior aspect of the mandible. It can be easily palpable, and you can clearly see its varicose course.
To describe the layers of the head, we use SCALP acronym. S stands for skin, C stands for dense connective tissue, then A for aponeurosis, L like loose connective tissue, and P like pericranium. The fascias of the head we can divide into 4 parts. We find the fascia masseterica over the masseter muscle, fascia temporalis, which is divided into superficial and deep, and it encloses the temporalis muscle, fascia parotidea, which encloses the parotid gland, and fascia bucopharyngea.
Muscles of facial expression are innervated by facial nerve. Its cranial nerve, the 7th. The muscles of facial expression can be divided into 3 groups. Those around the eye, those around the nose, and the group around the mouth. The characteristic feature of all of them is that one of the attachments is located on the bone and the second one is in subcutaneous tissue. So when the muscle contracts, it moves the skin. The occipital frontalis muscle is the muscle of the scalp. It consists of 2 bellies, front belly and occipital belly. They are connected to each other by the epicranial aponeurosis in the central part. Here we can see the orbicularis oculi muscle. It consists of palpebral part and the orbital part. Its origin is at the medial orbital margin, here, and the lacrimal bone, and its insertion is on the skin around the margin of the orbit, and also at superior and inferior tarsal plates. The main action of the orbicularis oculi muscle is to close the eyelids. Palpebral part does it gently and the orbital part tightly. In the medial region of the eye there is also corrugator supercilii muscle. Its origin is at the medial end of superciliary arch, and its insertion is in the skin superior to middle of supraorbital margin and superciliary arch, here. It draws eyebrows medially and inferiorly, creating vertical wrinkles above nose. There are 2 muscles that insert to the skin of the upper lip. First one is called levator labii superioris. Its origin is at the intraorbital margin of the maxilla, here. And then there is second one, zygomaticus minor. Its origin is at the anterior aspect of the zygomatic bone, here. And then it goes down to the region of the upper lip. The main action of these 2 muscles is to dilate the mouth and retract or elevate the upper lip. The buccinator muscle, so-called cheek muscle, originates at the pterygomandibular raphe. It goes anteriorly to the angle of the mouth. It's in the second layer below the zygomaticus major muscle and the depressor angulioris muscle. It can be seen as a background of the facial artery anteriorly to the masseter muscle, anteriorly to the parotid duct, and posteriorly to the angle of the mouth. There are other muscles that inserts to the angle of the mouth, so-called modiolus. It's zygomaticus major muscle, which originates at the lateral aspect of the zygomatic bone. It's levator angulioris, it's risorius muscle, and depressor angulioris. Here we can see the depressor angulioris muscle. To the skin of the lower lip attaches the depressor labii inferioris muscle, which can be visible over here, and the fibers of the platysma. The main action of these two muscles is to pull down the lower lip.